Hello, happy Veterans Day, everyone. Happy Veterans Day, Hayley.
Happy Veterans Day, Micah.
Hello, it is November 11, 2024. Welcome to the Monday Lunchtime Digest. It is good to see everyone. I am having a hard time getting going today. My
Oh,
my brain's been all cobwebby, so I had to stop and get some Starbucks on the way in today. But I am very happy to be here.
I
So,
don't blame you.
yeah, Hayley, how are you doing this morning?
I'm doing well. I am caffeinated, so now I'm working on getting hydrated, and so my day's off to a good start. I should say.
Awesome, awesome. Well, tell us what is going on with OCI.
So lots of awesome things going on at OCI. First of all, we have published a few more trainings since I was last on. If you go on to counselinginstitute.org or go to the CEU site, you will find, I think we have 4 new trainings that have been published in the last couple of weeks. So we have a couple new ones with Dr. Paul Hardy. Both are substance abuse specific. And so any of y'all LADC folks who are needing those substance abuse specific hours, those are up and available. But if you're not an LADC, I think you'll find them interesting too. One of them that I really enjoyed in particular was solutions focused therapy for substance abuse. And there are a lot of elements in that training that I feel like were helpful not only in working with folks who are experiencing substance abuse, but just for folks who might benefit from the solutions focused perspective in general. So that one is now up and ready to go. We also have a course on human trafficking that is up and ready to go. And we'll soon be posting Dr. Julie Colzette's training on insomnia. And so if you need some last minute CEs, if you are an LMFT or an LCSW and are trying to get your CEUs wrapped up for the end of the year, we have plenty of opportunities for you. But if you're an LADC or LPC and want to get a head start, we have plenty of opportunities for you too. And on top of all that, we also have our annual winter webinar weekend coming up. The winter webinar weekend will take place December 5th, 6th, and 7th of this year. We'll have 18 live CEUs spread across 6 different courses, spread across 3 days. We have everything from ethics to supervision to general to strength based. And so if you have any questions or if you're interested in learning more, you can send us an email, hello@edmondcounseling.com, or text us at 405-440-3034. Or you can also just go to counselinginstitute.org. Did I miss anything, Micah?
No, I think that's it. I'm really excited about what we have lined up for the winter webinar weekend. I think it's going to be a really great time. So certainly come check us out. As Hayley said, if you need those live CEs, then please come to us and check it out and let other people know. We all also are NBCC accredited, so accredited provider for them. So a lot of licensed professional counselors in other states are able to get their CEs from NBCC providers. And so, we have gotten more people from all across the United States that have started to enjoy our courses and then also join us in live webinars. We had one at the last one that was calling in from Arizona. I was just checking this morning. We have some from Maine, Oregon, um, many from Texas. So places from all over the United States. So if you have any friends or colleagues that are in other states and need continuing education, please send them our way.
Yes, please do.
So Hayley, what is going on in Oklahoma mental health news?
So, something that I found is going on in Oklahoma mental health news is Representative Olson is actually hosting an interim study on corporal punishment use in Oklahoma City schools, or I'm sorry, Oklahoma schools. So, corporal punishment is otherwise known as spanking. It is a physical punishment that the Oklahoma School Board does allow schools to engage in. And as of right now, 137 of Oklahoma's 512 districts allow for corporal punishment. And so the object of the study is to look at not only how many schools are using corporal punishment, but also how it is being used. Because right now, there's not many standards, from what I understand, for what corporal punishment can look like. Of course, we think of spanking, we think of the paddle, but in regards to severity, in regards to how often it's used, they're really looking at what is effective. And now, according to a couple of national organizations, including the American Academy of Pediatrics, corporal punishment should not be used at all in schools. It's reported to be ineffective, if not harmful, and the Oklahoma schools do have some safeguards. They're not allowed to use corporal punishment against kiddos who have profound intellectual or cognitive disabilities, but otherwise, there's not a lot of rules that really state how it can and can't be used. And so right now what they're doing is they're looking at how it's used, if it is effective, and then we'll be seeing what those reports look like soon. I'm sure that this study will inform a lot of what will happen in the legislative season coming up at the beginning of the year. So to be continued.
Yeah. Yeah. Thank you for that, Haley. And yeah, I know a lot of the research that's come out over the past few years is showing that corporal punishment is not effective. And then I wonder, in a school setting where you have some child that may have a history of trauma and getting corporal punishment from somebody that they don't know well. So this isn't even like a primary caregiver that is doing it, but just somebody else. I wonder how that would affect their mental health.
It truly does not seem like a trauma-informed response.
Yeah.
And I know that the Oklahoma school districts have really been incorporating trainings and continuing education opportunities for teachers to become more familiar with ACEs, adverse childhood experiences. And so hopefully this, if they're viewing the study through that lens, hopefully this will make some changes in regards to how corporal punishment is handled in Oklahoma City schools.
Yeah. Yeah. Well, something else that's coming out of the state capitol is, recently Governor Stitt announced the Office of Faith-Based and Community Initiative that is linked to that. Let's see what I wrote down here. That links state agencies with clients that need organizations, that need help with different services and things like that, with nonprofit organizations and houses of worship. So, I think, one of the things with them connecting with the faith-based community, and I'm sure that may bring up some questions for some people as far as state government doing something like that. But I think that the thing that I kind of wonder about is what exactly does that look like? If you have a client who, needs something, if they need a, food or something like that, and this church, has like a food pantry or something like that, do they give them just like a list of here's some places to go try? Do they try to actually like call them and connect them up with somebody for more of a warm handoff? I just wonder what that looks like logistically.
Right. And so it's an interesting thing, and I haven't heard of any other states having such a position. Have you, Micah?
No, I have not. But then again, I mean, I'm not in the loop on a lot of that necessarily. But, I know when we have Unite Oklahoma, that has more of a little bit more of a warmer handoff, to services. So I wonder how logistically this would work. So we'll be curious to just kind of watch and see how that ends up unfolding. And then the other news that I have today is talking about the increase calls to the Trevor Project crisis line after President Trump was elected, up 700%. And so if you're not familiar with the Trevor Project crisis line, it is a crisis line for those in the LGBTQ plus community. And so they saw a huge increase in their calls after the presidential election. And I know with the clients I've been seeing, there's been just increased anxiety associated with the election. Haley, have you seen that?
Absolutely, I have. I've had a couple of folks actually return to counseling over the last week or so after discharge due to the reported anxiety regarding the election and change in administration.
Yeah. So, Haley, do you have any other news today?
I do. I have one piece of news that came from NPR, and that is a study of Ozempic. And so Ozempic is one of the, I believe, GLP-1 inhibitors that's been prescribed recently for diabetes 2 management as well as weight loss. And so preliminary research is finding that not only is Ozempic and Mounjaro and similar medications helpful in reducing cravings for food intake, but what it's also finding is that folks who meet criteria for an alcohol abuse disorder, what they're finding is that folks who meet criteria for alcohol abuse disorder and or are Ozempic or Mounjaro or similar medications are showing a 50% reduction in alcohol intake. And folks who meet criteria for an opioid use disorder are showing to have a 40% reduction in opioid overdoses if they are on Ozempic, Mounjaro, or similar medication. And so the research is still really new. It's not FDA cleared to treat these disorders by any means, but it does gain some more evidence to suggest that these medications might be helpful for other off-label uses in the near future.
Wow, that is fantastic. Wonderful. Wonderful.
Absolutely. And it's something that, I've heard a lot of clients on lately, and a lot of clients have talked about, benefits of it too. And so hopefully it just continues to help people.
Yeah, definitely. So, Hayley, do we have a winner for this week's drawing?
We do. Our winner this week is our old friend, Carol Nicolette. Yay,
Hey,
Carol.
Carol, congratulations to you. I still need to get out her winnings from this last time. And so I've gotten a little
Oh,
behind
no.
on those. I still need to get those out. So if you haven't gotten your gift card in the mail yet, I am working on that to get that to you. But Carol, congratulations. So Carol won a gift card to Starbucks. So welcome. And thank you so much, Carol, for your support. So Hayley, how can people be like Carol?
So you can be like Carol by doing one or all three of three things. You can like this post, you can share this post, or you can comment. Every time you do one or all three of those things, not only do you help feed the algorithm, help us to be seen, but you also get entered into a chance to win next week's drawing. And so to comment for this week, we want to know, what is your favorite fall baked good? I don't know if your household is like this, Micah. Whenever fall comes, like, I am in a baking mood. I want to bake apple pies. I want to bake banana bread. I want to bake cupcakes. I just want to bake, 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 which means a lot of my friends are going to get lots and lots of pastries over these next few weeks. So I want to ask you, Micah, what is your favorite fall baked good?
What is my favorite fall baked good? Probably I'm just going to have to stick with something kind of boring and standard, but pumpkin pie. I do enjoy
Mm,
pumpkin pie. Yeah.
that's good. That's a good choice.
So, Hayley, how about you?
I really love apple pie. I got into making apple pies during the pandemic, and I am really good at making pie crust. I'm going to toot my own horn. I am great at making a crispy, delicious, flaky pie crust, and so I love my own apple pies.
Well, fantastic. Well, we'd love to hear from you. What are your favorite baked goods during this time of year? And as Hayley said, like, share, comment. And each time you do any one of those things, you'll be entered into win our drawing for the week. And we appreciate everyone's support. Anytime that you attend one of our live webinars, you watch an on-demand course, you come to one of our in-person workshops, or you just tell a colleague about us, you are helping to support the mission of providing quality continuing education to mental health professionals. So thank you guys so much.
Yes, thank you so much for joining us, and we'll see you next week.
All right. Bye, everyone.
Bye.